Health Minister Nicholas Steele has confirmed recorded cases of the hand, foot and mouth disease on the island.
Just before the Easter break, we had a total of 4 or 5 cases of foot and mouth. 2 different schools. Those schools were closed immediately. They're preschools, which is where we see foot and mouth showing up seasonally, almost every year. So they were closed out of precaution, would be sanitized, etc., before they're allowed to reopen.
Symptoms of the hand, foot and mouth disease usually include fever, mouth sores, and skin rashes commonly found on the hands, mouth and or feet. He says the practice of proper hygiene is key to preventing this disease.
Foot and mouth shows up almost every year with kids under the age of 5. It's transmitted from hand going to mouth, etc., and so picking up stuff, putting it in your mouth. And once we pick it up, we close the institution, have it sanitized, etc., and it goes away. We wouldn't be seeing it now in most of our other places because everybody's supposed to be practicing the COVID protocols, which are the regular sanitizing of hands. But with the younger kids, age up to 5 and under, it's very difficult to have them follow that. So that's why we're seeing it reappear again this year as it does every year.
According to the Center for Disease Control, the CDC, the hand, foot and mouth disease is common in infants and children younger than 5 years old. It is characterized by sores in the mouth and a rash on the hands and feet. The hand, foot and mouth disease is commonly caused by a Coxsackie virus. The usual period from initial infection to the onset of signs and symptoms, or the incubation period, is 3 to 6 days. A fever is often the first sign of the hand, foot and mouth disease, followed by a sore throat and sometimes poor appetite and unwell feeling. 1 or 2 days after the fever begins, painful sores may develop in the front of the mouth or throat. A rash on the hands and feet and possibly on the buttocks can follow within 1 or 2 days. There is no specific treatment for hand, foot and mouth disease. Frequent hand washing and avoiding close contact with people who are infected may help reduce your child's risk of infection. For GBN Health, Janelle McDonald.